Hello, everyone. It's Dr. Durst with Revitalize MD. And today I want to share with you my favorite laser treatment, the Fotona 4D facelift. This is an amazing treatment. You get 4 laser treatments in one session, just one session. And we're going into 4 different areas for amazing collagen and elastin stimulation. Why you don't hear about this one as often as you should is because this laser is a very high tech laser. It does lots of different things. One of my favorite things that it does in services is the Fotona 4D facelift, but it is a very hard laser to use. And so, not just anyone can use it. Our office is very skilled on this laser, and you get amazing results when you get treatments done here. The Fotona 4D, again, is one of my favorites. It's my go to, over 40 and definitely over 50. I'm talking to most women about this as a first line for stimulation of collagen and elastin. So, what happens with this? You come into the office, and again, get some numbing medicine after your face is prepped for the procedure. And we're going to start the first step. And again, it uses a couple different wavelengths. You don't really need to know the details. It took us a long time to learn the details, but the bottom line is the first step, we're going to go inside the mouth. And that's right, inside the mouth, inside the nasolabial folds, because again, that's the best way to get that deep dermal and we get stimulation of collagen and elastin. But to get that through the skin and all the way into the deep dermis, it's painful. It's what all therapy used to be, is you would get deeper into the dermis, but it's a painful procedure. You don't get any results immediately with all therapy. And with the Fotona 4D, we can comfortably get that deep dermal layer from going inside the mouth. So around the mouth, we get those wrinkles and lines we don't like. The nasolabial folds, we can pop out with the Fotona 4D inside the mouth. So we're hitting the deep dermal layers there. And again, with this treatment, you're going to get results immediately after the treatment. They're cumulative, so they get better over time. You're forming collagen elastin over the next 2 to 3 to 4 weeks, and then we're doing another session. So the first step inside the mouth, that's with an erbium laser wavelength. But then we're going to go to 2 steps on the outside with an Nd:YAG that hit the mid and upper dermis. So basically, you're thickening the entire skin surface. I consider that the mattress. The dermis is the mattress. So basically, you're going into the mouth to get the deep dermis. So if your mattress is here, we're going into the mouth to get the deep dermis, and then we're doing mid and upper dermis. And then we're going to finish with a sheet on the top. That's our epidermis. So we're going to resurface the epidermis. And that's the great thing about this laser treatment. Not only do you stimulate collagen and elastin, and we lose 1% of collagen a year. So if we start at 40 or 50, we're 40 or 50% down. So always a series of 3 to start. You're going to thicken the entire mattress, but then you get the resurfacing, which no one talks about enough. We can do a mild resurfacing usually with the first treatment because, again, we don't know how your skin's going to react. We can go very deep with the resurfacing with some more downtime. But if we think about what resurfacing is, so like this wood can get scratches or it can get dents. So if we have scratches, those are just very superficial. One sanding might get enough of the scratches out. But if you have a dent in a piece of wood or, deeper wrinkles in the skin, then it may take us more. So you're going to sand a little bit, then you're going to come back and sand some more, and then you're going to sand some more. Well, we can sand it all at once, but you're going to have downtime with that. And that's what people aren't crazy about doing anymore. CO2 lasers did an amazing job at resurfacing, but you're talking about months of downtime with it. Where this one, we can do something with barely any downtime, a little redness after the procedure, or we can do 2 to 3 days of downtime, or we could do more because this laser, we can dial in the depth. And again, we have all kinds of control over that resurfacing, which is the final step of the Fotona 4D. So what laser treatment can you do where you're getting 4 laser treatments in one that is going to thicken the entire surface of your skin, so all of the dermis, and it's going to pop out those nasolabial folds. It's going to improve the wrinkles around the mouth. And when we get to the resurfacing, which is part of it, you're going to get improvement of fine lines and wrinkles, pigment, texture, pore size, all of that improves. And again, you're going to get results with each treatment. It's cumulative. So over 2 or 3 weeks, you're going to see better results. And then by 4 weeks, we're definitely doing another treatment. We usually do it in a series of 3. separated by a month. And then sometimes we'll say a treatment a decade because, again, we lose 1% of collagen a year. We don't start until 40, 50, or 60. We might be 40, 50, or 60% down in collagen. So you're going to see improvement. You're going to love it. But then frequently, if we have a couple decades still to catch up on, we may do another treatment or two. And again, we always start with the series of 3, start you again on some collagen powders, some good, basically building blocks internally that are going to help build out collagen elastin. Make sure that we talk to you about skincare products, make sure that we talk to you about, again, sun protection and using a good sunscreen. No reason to do any of these procedures if you're not going to protect your skin and you're not going to use good skincare to get sustained results. So again, it's not uncomfortable. So the other questions that we frequently get, again, can you use it anytime? I'm going to be going on vacation. It's summer. I'm going to the islands with my kids. You can use it all year round. And again, sunscreen is the key there. You don't want to go out in the sun for the first 48 or 72 hours, but then it's fine. But you got to use sunscreen. Is it painful? And it's not painful. You might have some mild discomfort, but it's very mild and definitely a comfortable procedure to have. Will you have downtime? And again, we've talked about that a little bit. Most of the time, you're not going to have any downtime. If you want to get a more intense peel, then you might have 2 or 3 or 4 days, but that's going to be a conversation you have with us prior to the treatment. Occasionally, in a very rare exception, you might get a little more sensitive or have a little more downtime than we expected. That's an exception and not the rule. So typically we can really plan around your life, your schedule, how many days you want as far as downtime. It's all year round, all skin types. Again, downtime is very minimal. Discomfort is minimal. 4 dimensions, 4 steps, 4 laser treatments in one, and anyone is a candidate. So again, if you're 30, you're 30% down. You may need 1, maybe not a series of 3. Then maybe we're going to a different type of like resurfacing or collagen elastin building laser treatment with you. But if you're 40 and beyond, then we're always starting with a series of 3. We're preventing any further progression of collagen loss. The results just get more amazing with time. We have some before and afters we're going to share with you. And again, if you have any questions whatsoever, please put them in the comment. But what I would suggest is that you make an appointment with the office. You can call or you can text. Again, like, subscribe, comment on anything you might want to hear in the future. We're willing to deep dive into anything aesthetics and wellness. And so if you have questions about this amazing treatment, please give us a call or visit our website and set up an appointment with us so that we can see when you want to start this amazing treatment. Thank you.